Hey everybody, Ben Hall back at Catto&Catto, and I know this is the meeting that you have been waiting for. Word has got out. There's going to be a 15-minute or less insurance webinar, and so far we're pre-sold. I mean, everybody wants to be in this meeting, so we are going to go over the benefits on this screen. And here is the good news: I come bearing glad tidings and joy, taken in context that it is insurance. We stayed with the same carrier. Humana on all plans didn't make any changes, so you don't need to change any doctors or anything like that. Prices either stayed the same or got better. I mean, hallelujah. That's just for those of us who were never popular in high school or anything else, insurance pricing is really all we have to offer the world anymore. So we get pretty jazzed about that. So all the things that we're going to talk about, medical, dental, vision, stuff like that, is inside this guide. What I have up on the screen right here are just different reasons the IRS tells us that whatever you pick can be changed. Okay, so in general, what you pick sticks for 1 year, unless you have one of these bullet points going on in your life: marriage, divorce, birth of a baby. If your sweetie is going through open enrollment, things like that, you can change whatever you choose during open enrollment, which is right now. But outside of that, you can't change anything, and that's set by the IRS. Okay, I'm going to give you a rule that I recently made up. So it's not a thing, or is it? It's called the 5 and 3 rule. Here it is. The 5 most important things you need to know about insurance, and the 3 areas that those 5 things apply to. Are you ready? Network, copay, deductible, coinsurance, out-of-pocket maximum. I'm not like, what is that, Billy Blanks on YouTube, like selling stuff or something, or the infomercial guy. Network, copay, deductible, coinsurance, out-of-pocket maximum. If you know those 5 terms, then you will be able to understand how, when, why, and where those 5 things apply to 3 main areas: doctors, hospitals, and drugs. Doctors, hospitals, and prescriptions are the 3 main areas in general that those 5 things apply with. So first, let's talk about network. National POS, point of service open access. That's one of the biggest things you need to know when you go to the doctor. Are you in my network? It's one of the 5. Second thing you need to know, copay. Copay is just a flat rate when you use something. You're going to pay a copay for office visits, like I have highlighted right here: retail clinics, virtual visits. You'll pay a copay for urgent care. It's not the true cost. It's a flat rate when you use something. You'll pay a copay on either one of these 2 plans, if my highlighter would work, for prescription drugs. None of that changed over last year. Network, copay, deductible, coinsurance, out-of-pocket max. Here's where it can get confusing. Some of the biggest differences between these plans are going to be in the deductible. Right here, a higher deductible means more money out of your pocket. A lower deductible means it costs more in terms of premium, the price you pay for it. So here you got a $5,000 deductible. Here you got a $3,000 deductible. These are our 2 base plans. Now, what you have after you meet your deductible, generally in a hospital setting. So we covered doctors and prescriptions. Those are 2 of the 3 main areas. Let's talk about hospitals. That's mostly when you're going to be asked to satisfy your deductible. That's the bucket you got to fill up first for anything else, and a hospital starts paying on your behalf. So here you're out $5,000, here you're out $3,000. Yes, you can arrange a payment plan. After you fill that bucket up, then you start sharing in cost. That's the 4th of the big 5. And that's coinsurance. Right here, it's 20%. So what does that mean? That means that once you've filled up $5,000, that next dollar, you're paying 20 cents on that dollar. You're not paying 100% on the dollar. You're sharing in costs. So you're paying 20%. Insurance company is paying 80% on every dollar after. And you pay coinsurance, kind of slows the bleed, so to speak, until you hit your out-of-pocket maximum of $10,000 on this base plan number one, 6,000 on that base plan number two. So a lower out-of-pocket maximum is going to be higher in terms of premium. A higher out-of-pocket maximum is going to be lower in terms of premium. That's the cost that comes out of your paycheck, which either stayed the exact same or got better than it did last year, if I hadn't said that yet before. So 5 most important things: network, copay, deductible, coinsurance, out-of-pocket maximum. Those things apply to doctors, hospitals, and drugs. Now let's take the 2 buy-up options. Still the same network. Copays are the same on these 2 plans, but they're a little less than the base plans. The deductibles are both lower than the pages you saw before, because the lower the deductible, the higher the premium. Coinsurance is 0%, which means you ain't splitting nothing, which is cool. Out-of-pocket maximum, look how this math works. This is genius. $2,500 deductible, 0 coinsurance. So how could you pay anything over the deductible if there's no sharing? There's no sharing. This is not parenting advice. This is insurance. No sharing in insurance, as long as it's in your favor, is a good thing. So your deductible equals your out-of-pocket maximum. In other words, once you hit $2,500 in a hospital, you're done. It's got copays for doctors and prescriptions, and pretty much the same as the 2 base plans. So really, you make your decisions on how much risk you want to take and how much you want to pay for that taking of risk. Here are all the prices. Again, same as they were last year. Next couple pages, I just bought a pair of, actually, you know what I just bought? I'm going to tell you. I just bought a hat that has a Sasquatch on it, and it's awesome. And you know what? Humana paid for it. Not because I do this for a living, or if this video goes viral, maybe I'll do something else. But it's because I do Go 365, and I'm walking around all the time, and I sync it up to Go 365, which is owned by Humana. And so I get points for it. I can get free stuff. And you know what I told my wife? I said, hey, you too could have this hat. But you got to get active on Go 365. Call us if you have questions is the easiest thing. You got to download an app. Everybody knows how to do that. My kids know how to do that. And then you can spin it at one of these places on bottom of page 5. If you can't find anything on Amazon or Target, Lowe's is cool too. What I'm scrolling through pretty quickly are just different levels and different things you can do. But honestly, if you have a question, we have 3 people in our wellness department, and they are primarily deployed towards Go 365 because we just do a lot in that area. So there are some steps you can take to earn some points, but call us and reach out to us when you have questions, because we'll be able to walk you through it. So there are all different ways to get points. When you have family coverage like me, the family is assigned a bucket of points. And so as long as you hit that number, any one person can hit the number, and the app actually does a pretty good job about just walking you through what to do and when. This page is a public service announcement. The biggest point is freestanding emergency rooms. Our emergency rooms outside of a hospital, don't go in there unless it's life or limb threatening, because 2 things are going to happen. Number 1, you're going to sit in a chair and wait. Number 2, you're going to get a huge bill, and you're going to have to go get anxiety medication just to be able to handle it. You will get billed like an emergency room. Just make sure you know where you're walking into, like a retail clinic. This is a slide and some information about how to find a doctor. Download the Humana app. I actually have it. I was on it the other day. I found actually a dentist online that I didn't think was finding new patients, and they went to high school with my wife. So, maybe that's why they did a bunch of dental work with no anesthesia. I'm wondering if that's the case. ID cards. Paper is so 1990, which is a time frame that is near and dear to my heart, but everything's virtual, and just get it on the app. Pretty cool. Dental policy didn't change the plans or the pricing. You've got a more bare bones option here on the left, and a more bare bones price tag, and a little more coverage, and a little higher price tag here on the right. Really what you'll see is this dental HMO is one policy that would respond more to like a strip center type of dentist. Doesn't mean that they're bad. You're just not going to see the same person. every single time. Fee schedule means there's a thick book like that that will tell you in advance of what each kind of fee for service price tag would be. So that'd be like your Horizon Dental, Castle Dental, places like that. Preventative on the right-hand side, everybody gets $1,000 per mouth, and that is applied to covered services. So when you go in and you get your routine exams, 3 per year. Isn't that fun? I was talking to somebody the other day and they said it was 8 years until they got some like a dentist to do anything. I'm like, man, I can't believe you're married. I mean, I don't know how you have a date like that, even if you are married. I don't know if their spouse knew that, but I wasn't going to bring that up. What do I know? I'm just the insurance professional who does this all day, every day. That's what I said. It's kind of passive aggressive, but on to vision. If you can't see this, you should probably get that checked. iMed Insight is the network, and you'll pay $10 to go in, and then you've got a choice to make. Do you want frames and lenses or contacts, not both at the same time? So this once every down here means you can't get glasses and contacts covered by insurance. So just take a look and see what the frames look like and the lenses that go inside them. Now, if you're as blind as me, you're not getting out for a $15 copay. I choose to shrink them down, but that's my choice. That just doesn't work for my Christmas card. Or you can go the contact lens route and get $130 for those, plus a little bit off the balance. Super inexpensive here. The vision is kind of like a prepay. You'll pay, if you're employee only, you'll pay $3 a paycheck, and then when you need something, you'll be able to get a percentage off the balance and $130 towards your costs. Aflac, quacking duck. If you've turned your television on anytime in about the past 15 years, you've heard of this. So accident, cancer, critical care, hospital indemnity. There's going to be a ton of real estate in here on these plans. I have a plan like this. Here's what they do. When something happens, money comes to your mailbox. If there's an accident, you have to seek care for it. Can't be self-diagnosed. Ow, my elbow hurt. Give me money. When there's an accident, you turn that into Aflac. You take a picture of it and it goes in through an app, and then they send money to your mailbox. It's actually not a bad gig. God forbid cancer should be a concern, or in family line, then depending on what type it is, there are lump sums that come straight to your mailbox for that diagnosis. Critical care is things like heart attack, stroke, also does include cancer. So it's more of all the things that you wouldn't want. So just make sure that you take a look at that. And that is another line, kind of like on Go365, it can get confusing easily. If you have questions on Aflac, just call us and we'll make sure that you get the right answer, because that tends to be, well, I was dealing with something in the past and now I'm not. Would this be covered? And if so, how? Just please make sure that you reach out to Justine in our office. She's great. And she loves your problems. I'll take compliments at any time, gift cards for coffee, food for my children. Justine loves your problems, so please call her. If you want to complain about this presentation, you can do so to Justine. I got a little off track because we're just having so much fun. Hospital indemnity, it sends money to your mailbox if you go into a hospital and you stay there more than 24 hours. Wouldn't interchange that with like a hotel or something like that. But, if you have to go into a hospital, it's nice if somebody sends you some cash in order to do that. EAP, if any of you have ever, particularly you guys, I can be a little harder on y'all because, I is one. If you're married, your wife at one point has said you need help. Mine has never said that, but I'm sure that yours has. EAP, call them. They'll fix you. It's free. Look right here. Look at the number. Call them. Get your problem solved. Get yourself in order, is what she says. If you're a female, you already have a leg up on so many things. So, you could still call them as well, but maybe you'll need to call to ask about the male in your life, I guess. Premium only just means this stuff is not taxed before it's taken out. Great late night reading material here. We are not going to cover for the sake of time. You can do so at your leisure, and we are going to end almost on this page. Employee Navigator, super cool. Welcome to the 90s, Mr. Bonks. I love Employee Navigator. Why? Because you just go online and you punch things and it'll take 6 to 7 minutes and then you'll be done. So this is how we're going to say our yeses and our nos. Employee navigator, company identifier is Stouffer. Click and follow the directions. How clean and easy is that? Questions, comments, call Sandra, call Justine at Catto. Let us know that if we can help you. We're very confident in the results of the plan this year. It has been a very, very interesting insurance market. Probably one of the most active I've seen since the Affordable Care Act, which I remember, but y'all probably don't. But we're confident in the plan designs and in the pricing attached to that. So we will close there. Have a great day. Bye-bye.